What is the reason for the frozen shoulder? How to diagnose it? And what are the treatments for frozen shoulder? Basically, frozen shoulder is, as the name suggests, the shoulder is frozen. That means the movements of the shoulders are restricted. Initially, few regular movements like combing, buttoning the shirts, these are the painful and restricted. This is difficult to perform. As the time goes, the restriction can become little more aggressive. And in that case, when the restriction becomes aggressive, what happens is the various movements becomes painful. Usually the pain is at the night. It increases during the night and at the sleep. Sometimes the sleep is also disturbed. What happens is various muscles around the shoulder, that's called as rotator cuff, or the capsule, there is something called as adhesive capsulitis, or the rotator cuff muscles may have some changes, and that causes the difficulty and painful movements of the shoulder. How to diagnose it? Usually X-ray is not that much diagnostic, but ultrasonography of the shoulder is a dynamic imaging which can help in diagnosing the reason for the frozen shoulder. If required, we go for the MRI of the shoulder joints. Now, what happens is, once the diagnosis is made, the treatment depends on the diagnosis, but the various treatments are available. Of course, the first treatment starts with the physiotherapy and few exercises of the shoulder to restore the mobility of the shoulder and strength of the rotator cuff. The second step is doing the dry needling for the frozen shoulder. So we keep various small dry needles around the shoulder muscles, and then active myosin bond is broken so that the muscle becomes relaxed and the pain decreases, the movement increases. If these two therapies doesn't work, these are the OPD based therapies. If these two therapies doesn't work, then there is something called as platelet rich plasma. If there is some tear, partial tear of any of the muscles of the rotator cuff, then what we do is we remove the blood, separate the platelets, and give the injection of platelet into that tear. That helps. And ultimately, if the patient is resistant to all this treatment, then full radio frequency ablation of the articular branches of the shoulder is a new treatment modality which helps in decreasing the pain and restoration of the mobility. Even this treatment can be done under the insurance companies. More of the insurance companies accept this treatment as a standard.